Looking around today, it's easy to forget how absolutely panicked people here were at the height of the outbreak in 2015-2016. You had expectant mothers who were jammed into maternity clinics, scared for their babies. You had some expectant moms who actually left, those who could afford to, left this region to continue their pregnancies. And this is remarkable. There was a huge drop in the birth rate, 10% in this state alone.
After the initial outbreak, nearly 120,000 fewer babies were born across Brazil. But in the years since, the number of cases of Zika across the region mysteriously plummeted to nearly zero. And now, maternity clinics like this one are once again packed with expectant mothers.
How far along are you?
5 meses.
Well, congratulations. Do you think about it at all? Do you worry about it?
Hoje não. Há alguns anos atrás, sim. Se eu engravidasse, eu ia ficar bastante temerosa, mas hoje não. Tem alguma síndrome, má formação, mas não em decorrência da gravidez mesmo, né? De outras doenças que podem ocasionar na gravidez. Mas a microcefalia não é algo que assim realmente me deixe tensa, muito preocupada.
Este é seu bebê, boca, nariz, braço, costelas, coluna.
Dr. Carlos Ronaldo believes there is a simple explanation for the sudden drop in cases.
You think people are immune now?
Yeah. Então, em 2015, Recife, a população do Recife não conhecia o vírus da Zika. Não tinha imunidade para a Zika. Então, a população praticamente toda foi contaminada. E isso construiu uma imunidade comunitária.
While fears may have subsided, there are new cases in the region, a sign not everyone is immune.
How old is Barbara?
Bárbara vai fazer 4 meses amanhã. É minha primeira filha.
This young mother was confident the danger of Zika had passed, but her daughter is one of 18 suspected CZS cases reported in Recife last year.
Foi uma gravidez tranquila, só que quando eu estava com 4 meses de gestação, eu tive 4 dias de febre, dores nos olhos, nas articulações.
Did you think that the danger from Zika was over?
Sim, eu pensei. A gente pensava que tinha acabado, né? Mas não acabou, até porque depois a minha bebê já veio outro bebê, né? A gente já ouviu falar e também já viu que tem um bebezinho com 2 meses também que está com microcefalia por conta da Zika também.
Even as the threat of potential infection still looms, Glacie's family is growing once again.
Is this your house?
Isso, essa é a minha casa. Essa é a minha casa, esse é meu filho Nicolas.
Olá, olá.
Esse é o Gabriel, o
olá,
Guilherme.
olá.
Esse é meu primo João Pedro.
Olá.
Meu esposo
Olá.
Felipe. Essa é minha cunhada Carmen.
Oh, olá, bom dia, Carmen.
Carmen is 5 months pregnant with her first child.
What kind of precautions have you taken since you've been pregnant?
Estou usando bastante repelente, 3 vezes ao dia, as ultrassonografias. Parece que o tema foi um pouco esquecido, sim, deixado de lado. Muitas pessoas já não falam mais sobre a microcefalia, já não tomam os mesmos cuidados que tomavam no início do surto.
What kind of questions did you have for Glacie when you found out that you were pregnant?
Como me cuidar melhor, como evitar, vendo a luta dela no dia a dia, me colocando no lugar dela realmente, né? Vendo as necessidades.
Every day that we talk to a mother planning a pregnancy, we can sense a concern. And this is a haunting menace.
Dr. Esper Callis is among those who suspect that previous exposure to Zika may protect populations from further outbreaks, but he doesn't know for sure. Even if he's right, in other densely populated areas in Brazil, like Sao Paulo, he says less than 5% of people were infected, leaving millions of people potentially vulnerable to the virus.
Why? Why the difference?
Why? Nobody knows exactly. Perhaps the introduction of the virus occurred exactly there in one season where there were lots of mosquitoes, lots of susceptible people, and this population living close together enough would allow the mosquito to transmit the virus from one person to another in a very fast pace.
But this is a heavily populated area.
It is. So that's why we can't tell when this epidemic is going to occur in this city.
It sounds like you're expecting one to happen.
Yeah, we are.
And
but
so
we don't know when it's going to happen.
It's not a question of if.
Any time.
Not a question of if, just a question of when.
Well, yeah, one day this virus is going to knock on our door and it's going to be transmitted.
Now he is one of a team of doctors around the globe racing against time to develop a vaccine. The clinical trial here is funded by the National Institutes of Health in the U.S.
So by doing this, we aim to create the necessary conditions to make anyone protected in a future encounter with this bug.
How much pressure do you feel as a scientist working on this vaccine to get some progress before that happens?
If this happens again, we're not going to have time. We need to get it ready. We need preparedness.